Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about the physiological dysfunction of Hashimoto's thyroiditis and glucose dysregulation. What does that mean? Let's take a look. Hashimoto's thyroiditis will impact blood sugar levels, and blood sugar levels will impact Hashimoto's thyroiditis. So when we have an autoimmune condition called Hashimoto's, it can create dysregulation of blood sugar. Oftentimes we have people come in and they feel these symptoms or waxing and waning of symptoms related to sugar. If they miss a meal, they can become angry, irritable, they can be really fatigued, right? So let's go ahead and take a look. When we have Hashimoto's thyroiditis, it will decrease the rate of absorption in the GI tract. So the absorption of sugar will be decreased within the GI tract because everything kind of slows down. And then there will be a decrease in the uptake of the sugar or glucose at the cellular level. Because what happens is you have to take the sugar from the outside and bring it into the cell to be processed, right? Or used for fuel. So there'll be a decreased uptake at the cellular level. There will be a decreased response of insulin and cortisol as a result, right? So your pancreas will create insulin, cortisol will be produced by your adrenals, but there will be a decreased response as a result of everything kind of slowing down. Over here, then you're going to have a susceptibility to hypoglycemia. If you have decreased absorption in the GI tract, decreased uptake in the cells, a decreased response due to insulin and cortisol, then you're going to be susceptible for hypoglycemia or low blood sugar. Low blood sugar is those people who get hangry, hungry and angry, irritable. Their energy will pick up after having a meal. They're the person who needs a cup of coffee to keep going, right? Or need a chocolate bar, right? So when we have that, and you start to feed this hypoglycemia with sugar, right? Chocolate bars, caffeine, and so forth, you will increase catecholamines and increase IL-17, which is an immune response, right? Blood sugar will impact hormones, impact immune response, and impact Hashimoto's thyroiditis. It's that simple. Then on the other flip side here, you can have a decreased insulin response to glucose. You have an increased receptor site resistance. That's called insulin resistance, really, right in here. What that means with those patients is they have symptoms where if they have a heavy meal, they feel sleepy, they feel tired, they get a little weight gain around the waist, right? They have a hard time staying awake after dinner. They're the one who sits down and all of a sudden they're just sleeping in front of the TV 5 minutes into it, right? Insulin resistance or diabetes can occur as a result of this. And then when you have excess glucose floating around in your body, it will glycate things like nerve tissue, blood vessels. So diabetes or blood sugar dysregulation can create things like neuropathy, numbness and tingling in the hands and feet, right? It can glycate the blood vessels and decrease blood flow, right? So when we look at Hashimoto's thyroiditis, it can impact low blood sugar, high blood sugar, and those in turn can impact Hashimoto's thyroiditis. Again, it's a vicious loop. Then we get glycated end products, which will increase inflammation, right? When you have peripheral neuropathy, you have glycation of nerve tissue, you have glycation of vessels, you start to create inflammation, and inflammation again impacts Hashimoto's thyroiditis. It's this vicious loop. You have to be able to pull on the web to balance things out in order to have a patient with Hashimoto's thyroiditis get better, right? Oftentimes, this is a missing link for a lot of patients who have thyroid issues. They don't realize they have these ups and downs of blood sugar that is continually flaring up their Hashimoto's thyroiditis, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. We'll see you guys next week on the healthy side. Have an awesome day.